Good morning, friends. David Wright here, or good afternoon, depending on where in the world you are. I'm your host of the Disruptive Innovators Champions of Digital Business podcast. And today I am lucky enough to be joined by Lee Rickles. Lee, it's a pleasure to have you on. Thanks for being here.
It's great to be here, David. It's going to be a really interesting conversation, I think.
I'm excited for it. Lee, just to start out, for those of our listeners who may not be familiar, can you just tell everybody a little bit about your current role?
Yeah, so I'm the Chief Information Officer at Humber Teaching NHS Foundation Trust. We're part of the NHS. For most people, the NHS in England, well, in the UK, but it does split between the home countries. It is this big organisation. Realistically, it's lots of different organisations, and my particular organisation, we provide mental health, physical health, so community-based, primary care, so doctors, nurses, and some smaller community hospitals in the Yorkshire region. My role as well, I also have some responsibility for mental health developments in my region as well. I take a lead on that. And also I head up a shared care record partnership called Interweave, as you can see on the background for those watching the video. I've quite an interesting time. I have a responsibility for the normal tech stack, so business intelligence, IT, program change, all the corporate systems as well as the clinical systems, information governance, and that shared care record capability. Some of them services we provide from a regional point of view. Some of them are just organisational based. That's obviously provided as part of an overall team. If I did all that, that would be brilliant. Realistically, I'm just the guy that tries to keep people. Give them some vision and keep everybody moving forward, and hopefully, try and get rid of that waste and create some innovation.
Yeah, well, I'm interested in learning more about. I know, and we talked offline about some of the stuff you guys are doing to accomplish that. So, excited to highlight that in the second part of the episode. But first and foremost, we like to start the episode with just one piece of actionable advice you might look to leave the listeners with today.
So yeah, actionable advice. So I would say always understand the consequences of your action or inaction. If you're a leader, whether you're a servant leader or you've got some, you're a more directive, that action's absolutely important to your team and your organisation, to give people confidence of decision. And sometimes understanding the lack of action or that inaction can really cause many problems. So yeah, I would definitely say that's one of my one I would actually really put up there. And I'd also add that treat people how you would want to be treated as well. The giving an action's fine, but do it in a way that actually is supportive, helpful, gives direction, and take that feedback as well. Action with no concept of data and information, just on gut feel, is probably poor. But yeah, I would generally say consequences, actions, and treat people well. Probably my key take homes there, David.
Yeah, great advice. I mean, it's funny that you mentioned that. I was having a conversation, I think it was just yesterday, with a CIO about how he had to learn how to speak up. He had trouble, especially earlier on in his career, voicing how he felt about a given situation, especially in a room of executives, and how he had to help his team step into that. I think that's a common thing for leaders to need to kind of grow into. And I think as we look to create a culture of innovation, treating people with respect and dignity, and really empathizing with people, and then encouraging them to bring those ideas, hopefully as empirically validated as possible, but bringing them to the table nonetheless, even if they fail, that's okay because, we learn so much from, integrating that feedback and moving forward,
No, I agree, David. I mean, I'm a big fan of Eric Rice and the lean thinking, and that failing fast, that learning through the experience and then pivoting. I think that's something definitely public sector bodies we really struggle with. I mean, in the UK at the moment, there's a big thing about the Horizon software solution in the post office, and where there's been a number of issues around there, where realistically, there was opportunities to pivot, develop, learn lessons, rather than the approach that was taken. I can't prejudge the outcome of any of what's currently going on there, but I think that thinking lean, which to be honest, goes my history has been quite varied, and also being not just pivoting, but having that value proposition and putting that value proposition in a context that works for the audience you're communicating with. And too often, digital leaders will think as in a digital mindset rather than what's the value? Why are we doing this?
What's the business use case?
Well, from a point of view, how do we show we get better outcomes from our patients? How do we make them healthier? How do we do preventive health? How do we make more efficiency so we can spend more money on doctors and nurses because we can be more effective? Or other alternatives. I'm sure AI will start showing up in that one in the not too distant future, or if it's not there already. Rather than, explaining we need to invest in Wi-Fi. Right, we need to invest in Wi-Fi. What's the value proposition? Right, just walk the floor with a member of staff on any ward on any given day that's going to do a drugs round or keep patient records up to date or access the communication system. Walk the floor with that person. And that's the way I try and run my teams and try and get them thinking that way. All of a sudden, you can see the value of some of the solutions because you can see the inefficiencies and the inadequacies with the current situation. So yeah, really a big fan of Eric and his and the lean thinking. I know it's getting a little bit dated, but I think the principles are all valid, and also that flexibility to act and do it quickly. Don't wait. Don't take 6 months to pivot. Just pivot and see what happens. And test them assumptions with the customers.
Right. 100%. Great way to kick off the episode, Lee. So before we get into the work that you're doing at the NHS and with Interweave, I am interested, Lee, to share with everyone just a little bit about, how you started out and how you got to be, the CIO that you are today. So maybe you could just tell us a little bit about your journey.
Yeah. So a bit of a convoluted journey, realistically. I started out as my parents felt that I needed a trade. So my dad was an electrician, well, still is an electrician to be fair. And it was, you need to get a trade under your belt, son, because you can always fall back on my trade. I mean, let's be honest, if I fell back on my trade now, I'd be a little bit worried because I haven't used my tools in many, many decades. So I'd be a little bit worried if I started, fixing boilers or that type of stuff. So started out as an apprentice fitter. I actually did real work and got my hands dirty. Had to put overalls on. Not that other people do real work. That was a chief exec who, when he realised I used to be an apprentice, they did make that comment. So interesting time where I was mechanically biased, although we did do electrical as well. Worked at Rickles, who provide a lot of pharmacy products. They're based in Hull. Enjoyed it. It was a 4-year apprenticeship. Completed all the paperwork side in 3 years. Got some development in the design side. And then very soon got bored of doing the same repetitive things. When you're repairing a machine on the production line, there's only so many times you can repair that machine. And you can't really change the machines when you're doing site maintenance. There's only so many times you can do it. So I have a very short attention span, so I got quite bored. So then I sort of moved across engineering background. Then BE Systems, it was they had an undergraduate program that they put out looking for interest. So sort of went sideways, went on to their undergraduate program with a mechanically biased as well. So fast jets, we did military aircraft. I was aerostructures. lots of very, very boring maths. So, and this was just as computer-aided design and manufacture was coming in. So there was some highly qualified guys that was allowed to use that type of technology. We just had to do maths longhand. And when you're doing lots of integration and differentiation, you can get, again, a little bit bored. Saying that, when I'd completed the undergraduate, when I graduated with my bachelor's in engineering, I then moved into projects in BAE, and I got involved in the Sea Harrier, AV8V, Hawk, T45 is the Hawks, the Red Arrows aircraft that's out that you might be recognise. The T45 is the navalised version that the US Navy used for a period of time. And even the Nimrod system, I was involved in that before I left. Generally, I got quite involved in the project side, generally did project work. One key thing I do remember, I moved from the very boring maths area, stress design. I mean, very well paid, don't get me wrong, but very, very boring, to the production area. And I picked up this job that the guy before me had been spending all week. He basically coloured in Gantt charts, worked out longhand how to do percentage complete of aircraft frames, jig utilisation, all some pretty standard stuff. I ran it the same way that guy did for a week, and then the following week I just used Excel and a bit of VB Basic and cut it down to half a day a week. So I think that was probably the first time I started really using technology to start apart from in my degree when we had to do some quite complex Kalman filter calculations and stuff like that, using tech. And then that developed into some of the projects where, although I was an engineer, I generally ended up picking up different data sets. So picking up the production data set, picking up the design data set, the product data set, merging them together, doing a bit of programming, coding, even though I wasn't part of the IT team, and then pulling that together as part of to understand where we actually were, to get that project reporting and then get some dashboarding. So that was sort of when I started touching on the technology side. One of the claim to fames as well, I was at Aerospace and Brough. It was our first royal visit, and that was because I was given, because I created so much capacity in my time, to restore a Sea Fury. So it was a bit like a Korean propeller aircraft. Claim to fame is it shot down a MiG-15. Well, about 3 or 4 of them shot a MiG-15, but the squadron leader claimed it. We was doing a contract with the Navy on Sea Harriers. There was an agreement between the Admiral and Chief Execs. We said we'd take a pile of scrap and build a Sea Fury VR930. If you do go on to Google and do a search, you'll be able to see it flying around. I got given that to lead with a very, very good group of engineers, some of the best ones we had at Aerospace. And there was a royal visit at the end. I'm sure we spent more on the royal visit than we did in restoring the aircraft, because it was the first time we'd had a royal visit in a long time. But that was really neat, and I've still got the photos of me handing it over to HRH on that one. But at Aerospace, the writing was on the wall at the site, and I did a lot of travelling around different locations in the UK, a little bit of international, so it wasn't unusual to turn up because on a Monday morning and then get told you're going over to Saudi, or even worse, you're going up to Prestwick in Scotland for a week or two. It's actually really nice, Prestwick. It's a nice microclimate. It's a nice set of people up there, to be fair to them. Or Farnborough. The main bit is young family, settling down, and I'm spending quite a lot of time working out of a suitcase and on a bit of a red team fault finding bit. And at the same time, my dad had a major stroke at that point. So it did need some more decision making. So that's the point I flipped to the NHS. For a number of reasons. One of seeing there's a lot of NHS organisations in my patch. With what was going on with some of the manufacturing, there was going to be relocation, and I took a decision to move sideways to the NHS. I had no idea that the NHS did IT or did projects. They do doctors and nurses. Why would they do these type of things? So I moved sideways into the NHS, and it was a massive eye-opener as a project manager that didn't do IT but came into an IT department that was quite small, to be honest. It was a slack handful of these guys that just fixed stuff, and they didn't even have email rolled out at that time. That was one of my projects, to roll out email at the trust. It was like, really, really, and that type of stuff, and also some electronic patient record. And there was patient administration systems there, but the amount of bureaucracy was such an eye on that, and understanding how complex the NHS was with all the different organisations, and it does like to restructure its senior, or shall we say, its management layer, so fairly regularly, which does cause some problems if you're an organisation that provides care, trying to get some cohesion on your strategy. And I really did struggle with the bureaucracy, and I think people struggled with me because I come in with all these ideas of you might actually have to have a plan, you might need to do things like end value analysis, and you might need to actually consider what the processes are you operate with. You've done a lot of lean work at aerospace, so I had all them ideas, Toyota production system, and then basically stayed in the NHS for the next 22 years. So I currently had my long service award. I had a nice certificate handed over by the chief exec a couple of days ago, and I must be honest, that did give a bit of a reflection of I've really been in here for 22 years. I'd probably equate the first 10 years, I was very program orientated, project orientated, and there was some digital stuff that was on the side of it. So like electronic patient records, we did a load of first of type nationally as part of the national program for IT, which actually was quite successful for us. Did quite some development in the business intelligence suite. I was very involved in service redesign and cost improvements. I'm probably, and there was a bit of a restructure about 10 years ago. And that's when I really started, I had a bit of an epiphany, a bit of a redirection. And that's when I really focused on digital. And that's when I started to see that as my profession. And that's when we really started motoring on, we can do things differently. So can we use our electronic patient records differently? Can we go full digital? Can we use our technology in its, digital first approach? So, from electronic staff record, from our finances system, I think our expenses system was probably the quickest system we ever implemented, fully enough. And I can't understand why people claiming the money back for expenses would be a big priority, but it obviously was. And I'm pretty sure for the first few months, it was far more accurate than our electronic patient record to show where staff actually had been travelling to, and what activities they was doing. But again, that's good use of technology to understand that, use the right system to manage the right thing rather than just trying to use trying to use a sledgehammer to do something else. Did quite a few developments with a company called TPP. We developed a new community hospital capability. COVID sort of came in. It really moved the digital capability we'd spent a lot of time invested in. So, we did have pervasive Wi-Fi. We'd already implemented Skype and a lot of the office products. All our equipment could be reused remotely, albeit the PCs did need a bit of an Ethernet cable. Oh yeah, and an Ethernet cable and Wi-Fi. Trying to explain to the IT guys why it's a good thing to have pervasive Wi-Fi when we've already got Cat6 cabling around everywhere. So, that's an example where I got the IT guys to start shadowing actual staff on the wards. And all of a sudden it become clear, we haven't got the cables where they actually need them. We can't put the cables where they need them. We've got some secure units in our mental health service. So actually the Wi-Fi makes sense. And if we put the Wi-Fi in, it actually gets them better access to some of their equipment, and we can give them different devices, and actually everybody gets a better experience. So big advocate of user-centered design, big advocate of walking in somebody else's shoes, understanding their experience, and a big advocate of getting them in. The digital team is not just a digital team. The digital team is a team of people that use digital technology in some shape or form. To where we have recently come to, which is Interweave, which is a shared care record solution that we use that covers 8 million patients in the UK. So bigger than Scotland, Wales, a lot bigger to be honest, from a population. Uh, it's basically, we took a slightly different approach. It's NHS owned, so public sector owned. But we just give direction to the vendors, so the SMEs, and we also deal with Google. It's an internet-first, cloud-based solution. But we built it from the point of view of what the clinicians actually need to see. What does a patient need to access? Not, here's a standard, build it. Quite challenging. Data quality was a major issue. But yeah, so the Interweave, major success. We actually used that technology to build an MVP, a minimum viable product, for the G7 countries to show the international patient summary and how it could happen, how it could use. It was an MVP, so it was not meant to be scaled, but a lot of that solutions and the technologies have been shared and reused by them particular countries. So, and now I'm here. I'm a fellow of the BCS, Fed IP lead practitioner, Chimes, CIO, and there's loads of other letters after my name, which, to be honest, I'm not sure exactly how I got them all, David, but I must have filled in some bits of paper and some forms somewhere to get some of that. And although laughing aside, although I have got them, that's because the digital profession is an important one, and it's one that's very undervalued in the UK, definitely in the health sector. So I am a big advocate of, and we use an organisation called Fed IP, which is part of the British Computer Society, as that vehicle for improving that professionalism. My organisation, we are a BCS organisation. I do fund that professional side for my team, and are big on CPD and development to make sure they do have the development and training they need, including we had a call today with a number of the team around user-centered design with a great company, because again, we're now down to getting that expertise more out with our quality improvement team and our operational teams, because it needs to be that piece that really, really is a compelling way of working. So that's sort of me, David. A bit of a convoluted journey. Started as an engineer, became a bit of a program person, hated a little bit when I was a cost improvement person, and then finally moved into digital, which, to be honest, I'm actually quite happy with. I really do enjoy the current role. It's never the same day. Great team I'm working with, great teams, and we do some really good stuff.
Yeah, I mean, really cool journey. Clearly and I think the letters are perfectly just embodiment of the fact that you're a lifelong learner, curious to continue to, grow and help people in doing that. So, no, very cool stuff. What, Lee, I mean, you've had so much different varying experiences throughout your tenure. But curious, is there something sticks out in your mind as one of the most important things that you learned along your journey? And, if you can think of something, maybe what life was like before learning it and after learning it.
Yeah. So I would say it is all about people. So I think it took me a while to realize it's not just a process. It's not just having a Gantt chart or a plan and a project document. It is all about people. It's all about persuading people, understanding people's needs. What's the requirement they have? How do you negotiate and manage expectations? And how do you deliver it? It is all about the people. The rest of it's window dressing. The rest of it is tools to get to that end of the journey. Even setting a vision and the blueprint. It's about people. Whether depends how you focus on that, and how you work that vision really depends whether you're looking for, and we might touch on this, is the faster horses versus jet planes paradigm that I know it's one I always struggle with, which is if we ask people what they want faster horses. Well, I'm pretty sure if I go outside now, I won't. 100 years ago, we'd have seen a lot of horses, but we don't see many now. But I'm sure we see a lot of jet planes. So how you influence people, how you set vision, how you build and get cohesion of a way of working really depends whether you want to be a bit of a mediocre, we'll have a bit of faster horses, or you're going to set a real vision and get jet planes and really make that difference. But again, it's still all about people. You've got process
Yeah.
tech, you've always got other bits. It's don't underestimate the people, the social aspects, the having that conversation to get to win-win. That's it for me. Get into yes is the key. And you've got to understand people to get to yes.
Yeah, no, 100%. And I think that's particularly important for IT and digital leaders, particularly, coming from, an engineering background or a background where you're doing program management. For you to arrive at that, at this stage in your career, I think is huge. Because I agree, whether it's, my internal customers, whether it's my external customers, the success of the services I provide and the solutions that support those services are in truly the perception of the people that are using it. It doesn't matter if technically something is implemented, to perfection if no one's using it. You know what I mean?
Absolutely. Absolutely. And 9 times out of 10, David, nobody cares about the technology apart from the technologists. The analogy I'll use there is, pilots don't necessarily understand how airplanes work, but there's a lot of engineers and a lot of people that build them. But they are confident they work and they know they work, but they're still not going to learn how to build an aircraft in the same way that the people that build aircraft may never fly and be pilots. So it's that eye of the beholder and be, and I think that's the key bit about people. You're having that conversation of what is important to them. And I think too often technologists think that people are interested in the technology rather than it's just a means to an end. And sometimes the priority could well be different to the cutting edge technology. It could well be. It's about price. It's about experience. It's about what's the funding? How do you get the cash flow working? It could be the IP. There's so many different dynamics, and I agree. The technology is very important. The standards aspect is very important. From a health point of view, we've got to have standards to interchange data and patient records. But does anybody really care what type of when you go to a petrol station, the electric is available apparently now as well. Just to be fair and balanced, do we really know what's in the diesel and the and the petrol and the different type? No, but we know it works. And the key bit is it works. And, the most important bit is how do I pay for this potentially? And is it
right.
experience? And am I queuing for a long time? Not necessarily the key bit that's there, which is the fuel you're going for. So absolute, David.
Lee, what about a time that you were challenged, either personally or professionally, or you had a project fail, but you ultimately took away a profound lesson from the instance?
So yeah, really good question, David. And I think from my perspective, a thought-provoking one was when I moved from programs to digital. It was linked to a restructure in the organisation, the NHS organisation I was in at the time. I was heavily linked to the existing management team, and there'd been a reorganisation. And basically, I'd just moved to managing the IT team after having quite a large team. So I was feeling quite low, quite undervalued. Not a brilliant position to be in personally. After I really spent a lot of time and effort to get the teams that I had developed up, we'd done some really good work. We had KPMG come in and assure our services were really, really good, really high value from a programmer and technology. And then basically, my face didn't fit in the restructure. So I just ended up looking after IT and put in that context, there was already a head of IT. So they really didn't need me there. So I could have gone away and think, career ending, what do we do? Or what I did use it for was an opportunity to reflect on, one, do I want to continue on the current role? What would be my opportunity? Talk to others and understand how people perceive me, where they see my strengths. And that's when I then thought, actually, this is when I could do to pivot fully into digital. When the view is that I got from the people I talked to is, you're very good at the technology and you're very good at putting a case together for investment or development or need in a way that most technologists don't do. So why don't you go in that direction? So effectively, I recreated myself from a point of view of, well, where do I want to go from a digital or a CIO perspective, rather than carrying on down that program route. So I changed that low period of my life into an opportunity. And to be honest, it's worked out really, really well. And that includes, I did a number of secondments for organizations, helped them implement their EPR to get back on my feet to some degree. And then when the opportunity of the Lycra piece came in, it was brilliant. So local healthcare record exemplar in 2018, when we got identified as one of the areas to do the shared care record development. So, it obviously, being a CIO fitted my role, but I needed that problem, that challenge, that changing responsibility to make me reflect and think actually there is a different path. So what I would say is, if anybody is listening, if you're in that situation, see change as an opportunity rather than as a negative. If there is a change, look at where you want to go. How would you want to develop? It's not necessarily the end of the world. It really is just the start of a new journey. And that's definitely how I felt. I didn't feel it at the time until a couple of years after really got my feet under the table and really started doing some really good stuff with my current trust. But take that opportunity to look at new opportunities. So never looked back.
No, it's great. It's a great lesson for me too, because I've had instances like that, both personal and professional, where, now looking back, those events were some of the best things that could have happened to me, because it led me to where I am today. Right. So the more that I can carry that perspective with me today, when I do encounter something that, doesn't go my way, like the fact of the matter is that I have no idea. I have no idea what is good or bad for me in that moment. Right. It could end up being, the best thing ever. So it just goes to show that I don't really know much, there's so much.
Yeah. It shows we're all constantly learning, David. I think that's the challenge. I think there's a quote somewhere: if you're the most intelligent person in the room, you're in the wrong room. I hope I never get there. I think it is a constant learning process. We've got to develop different skill sets, different teams, developing people, coach and mentor and support. So as long as we're doing that, the reality is there will be a bumpy journey. Sometimes it'll work out well, sometimes it won't work well. The key bit is reflecting and learning from it. And if we learn, then we improve and move on. If we don't learn, then we'll just keep repeating the same mistakes. And then we'll feel we are the most intelligent person in the room, and that's the right thing, which is not so good.
Right. Agreed. So Lee, I want to get into just a little bit more about what you guys are up to at your trust within the NHS. Maybe a little bit more about interop and some of that kind of stuff. Before I do, I always like to just ask favorite book, either that you've read recently or all time. Your choice.
My favorite book is it's The Rise and Fall of the Great Powers by Paul Kennedy. So not that I couldn't remember it, but it's I've got it next to me. Not that I'm reading it all the time, David. It was just so it's a really good read. It's 500 years of the Rise and Fall of the Great Powers. And the interesting bit now is some of the assumptions, because I read that in the 90s, and it's always a good one to dip in and out of. Some of the stuff around China and India and the development is now starting to happen. So I'm starting to feel a little bit old in some ways, but it's a really good read, because it uses a lot of data, which I must be honest, that's sort of my thing, with what was going on in them particular periods of time and why empires rose and fell. And I think that's a good reflection for as organisations, how can you take that into account so you don't become stale, you don't become, you don't create your own limiting factors, and you're always trying to be new and innovate. So yeah, I really like that book. Just a little bit. I'll just put another one in there. So that's my shall we say more the one I read when I want some data. I also like a lot of David Gemmell as well, for any of the sci-fi out there. Legend is always one I can pick up, read a couple of chapters, and just sort of zone out. It's an excellent fantasy one. I really like that author. So yeah, although I do listen to lots of podcasts, David. I do a lot of running, and because I do listen to lots of podcasts, including this one. I've been listening to this one while I've been running as well, but not this one we're listening to. But yeah, since I've met you, I've been listening to all the other ones in the back catalogue, so I'm getting through them, and they are good listens. To be fair, I really enjoy them.
Well, appreciate it. Appreciate the feedback, Lee. So Lee, let's talk a little bit more about your current role. So talk to me a little bit more about your vision for your swath of the NHS, the Humber Trust, and maybe some of the key initiatives that you guys are focused on.
Yeah, so thanks, David. So NHS is quite a complex beast, so I will keep it to my organisation and the region I'm in. Otherwise, we could really lose several hours in conversation. So where are we? I think it's probably aligning it more to the Maslow's digital hierarchy of needs, if such a thing exists. So I would probably say we've got quite a lot of the basics in there. We've got Wi-Fi, we've got internet, we've got gigabyte connectivity, we've got good devices, good equipment management. That's just stuff that happens. That's the utility. That's your gas, your electric. And I'm fortunate that my organisation see it that way. So it's actually quite well funded in that respect. Some of the key things we are involved in, we're currently changing our electronic patient record. The current one we've got really isn't user friendly. Staff have really found it really hard to use. It's not. It really is a poor user end design. It really doesn't work for the organisation. So we've done a procurement, and we're now implementing putting a new system in, which is making the organisation think differently. There's a level of standardisation, but not ruthless standardisation. Think Toyota production system, but amending based on culture and small changes and dynamics, rather than letting everybody do what they want. So a lot of work going around the change management and the user-centered design with them operational teams at the moment, and how we actually migrate data. Data in the NHS is an absolute nightmare, to be honest. Just because a lot of the systems don't comply to standards. So quite challenging. So that's an interesting one. It's a pretty standard one, to be fair. The key bit we've got from the electronic patient record is really getting the access to the patient as well, and getting that interactivity. Now that's pretty box standard. There's nothing exciting in there, but it's definitely a key one for my organisation, and it's key that it is completely owned by our operational colleagues. Because again, they're the ones who will use it. I'll never use it. They have to. Far more interesting is probably where we are on the shared care record in Interweave. So Interweave originally started as the Yorkshire Humber Care Record. We expanded into Leicestershire, Nottinghamshire and Derbyshire. Funny enough, the people that live in them regions don't want to be classed as Yorkshire people. Fully understand that, so we come up with the branding Interweave. Occasionally there is another Interweave company out there, and occasionally we do get requests for brochures for jumpers and things like that. Not that often. It's Interweave Digital if you're going to do a search on it. There's lots of information. We are very open. It's all our design documents, our standards. So fast health interoperability standard design work is on there. So it's quite interactive. Anybody who is into health and sharing of information and data, we do put most of that information in the public domain. It was part of our key selling point, and we are a public body, including our interoperability adapter. So we've got this thing called FIRE is Fast Healthcare Interoperability Resources. and we've got a bit of technology called Interweave Connect. It's a fire appliance. They're basically you plonk onto your EPR, your electronic patient record, and you plonk onto your integration exchange, and basically it creates then connectivity. That's on GitHub. If anybody's interested and wants to play with it, by all means do so. And there's some of the things we have built in there. And that's the sort of principle we've got, which is very much around an agile, user-centered, focused approach to designing the product set based on a clear set of needs and use cases. So it's constantly in development. It's got a small NHS team. We host them within Humber. We work with SMEs. So one of the companies we deal with is Synenetics, who are a key provider of the technology solution, although we do use a lot of open source. We also have it on Google Cloud Platform and its internet. We've had that since 2019. So we've been cloud for quite a while. And the key bit that it does is we take the data from, it's a federated approach. So when somebody says, actually, Mrs. Miggins has a problem and I need to find out about Mrs. Miggins, they go either into their electronic patient record if it's connected, do a search on Mrs. Miggins, and it brings back the information held by primary care, on any other organisations, mental health, community health, local authority, adult social care, something like that. In that respect, so she gets it all provided in real time as requested, and that normalized deduplicates the data and that type of thing. We do have a portal because again, some of our partners didn't have the ability to view it, and the electronic patient record community can be a bit of a challenge on interop in the UK. We have got an act going through which will change the law to make it a mandated requirement, but it does, on that respect, it does depend how that's regulated. Now that's currently being decided how that regulation happens. So some really interesting stuff. That's the same technology that I mentioned earlier that we use as the minimum viable product for the international patient summary. So basically, you could share that record with others. QR code. So pretty basic stuff, stuff that people know well. QR codes are well known, operate well. Text message validation for multi-factor authentication, well known. Use the technology. Using the NHS login in the UK, in England, actually, is a known piece of technology. A lot of the population in the UK have access to that since COVID. And the thing with Interweave is it's been developed and developed. So when we release regularly, every 2 to 4 weeks, we release new functionality based on the customer's needs and requirements. And it just depends what the scale and level is. The key bit is adding value. Are people using it? At this point in time, from one example recently, we know where we implemented at Bradford Council, and the initial feedback is 71% of the staff there. So it's significant value and would save them in the order of 1 to 2 hours per day, rather than chasing records. Well, a lot of paper records out there in health and social care. We are very much digital dinosaurs. If we're looking at conveying for ambulance services, we've reduced the number of ambulance conveyance for end-of-life patients by around 40%, because people actually have information, and a lot of our patients have the choice of where they wish to die, or actually what the care and support required. So they don't have to, because ambulances in the UK will try not to take you to a hospital. To try and care for you at your home or in another urgent care centre, redirect. So it's getting the right care to the right place. So that's the key principle.
When the ambulance gets there, right? I heard that sometimes to get an ambulance can be tricky, at least in certain areas of the UK.
So it can be, but again, it's if you get the ambulance and they don't have all the information, then you're relying on the ambulance asking the person that's got the problem and or their carers, who are probably hyper stressed out because their loved one is not feeling great, and then you're expecting to get coherent messages. I know I've had experience myself when I've took my mum to ED on a few occasions, and I know for well, and this is going back a few years, I know for well you can access all this information on the system. So and the consultants wants to see your prescription data so they can actually see it, eyeball it, rather than use the system. But that's, again, you never use a centre design because the equipment was not in the right place. So you're absolutely right. It can be hard to get ambulances, and then when they're there, and that's when we have this concept of fast responders. So if somebody gets there first, to start providing the care, having access to the information so you know what meds are being prescribed. You've also got mental health meds, as well as primary care meds they may have, any particular care planning, any particular information that would be pertinent and would useful. And it's having access to that information so everybody gets a better experience. The patient feels that you actually realise what they're at and you can provide the right care. The professional has the right information to then make, they as professionals can then act upon it and not have to guess. And even if we had to convey someone to the hospital, that information is sent to the ED department in real time. So, and their vital signs information is shared with the hospital. So at least they can prep depending on the seriousness, or triage remotely. So there's a lot of good stuff around there that we do on the Interweave team. The trust does, I'm probably underselling. We do have pervasive Wi-Fi. We have patient access to our Wi-Fi. We've had that for a long time. We just put in the Databricks and Data Lake. So we're replacing our old data center to a new one. Databricks looks a really good tool, to be honest. They're very, very, very capable. We're putting that onto Azure. Again, you don't need to have one cloud vendor. Multiple cloud vendors are working in a hybrid mode. Absolutely works fine. We've practically no equipment on premise anymore. It's generally all in the cloud these days. Although I've got all that, I will just do a little bit of reflection on some of that. That's taken some real thought-provoking conversations and understanding of what patient and customer needs are. Again, the point of digital, when you're looking at technologies, things like, why don't we use a shared tenancy for our Outlook, our email exchange? The person you're going to probably ask is the one that currently runs it. So it's turkeys for Christmas. So we're going to completely change your role. We're going to stop you having a need, or that's the way it can be perceived, rather than what you're actually saying is we want you to do some really exciting stuff. We want to develop your skill set so you can do some, you can go to the next level. And I think that's part of the journey I'm probably underselling I've gone through on this interesting stuff, David. It's how do you persuade people it's not turkeys for Christmas and it's innovation and development. And I'm now having that same challenge with a lot of the operational people, because although we're doing this work, the key bit is not providing Interweave. The key bit is changing the practice of the paramedic or the 999 call taker. So they, by default, look at the information, make a decision, inform the next person, or does that inform how you prioritize ambulances, looking at what the presentation is? Or if the ambulance arrives, have you changed how you operate so they're actually doing the real-time data entry and not doing the update when they're, blues and twos back to the hospital? Or if you're in local government or, social care, are you using that to inform the information you generally need and change basically changing your way of working? It's the not faster horses, it's the jet planes bit again, which is, are we really trying to move things forward or change how we work, rather than, getting people a little bit concerned that you might be, look, we're saving like the 2 hours per day with social care. Does that mean we're going to make some social care people redundant? We cannot get hold of people for health jobs for love nor money. We spend a lot of money on bankum locum, so basically contract staff that tops up. This is the opportunity to reduce the contract staff level.
Yeah. Or even if you're just addressing like attrition, which I'm sure you guys deal with just as we do, it's still significant because the cost of attrition is actually going the other way, right? So
yeah, and there is, from a health point of view, from a staffing, there is a high turnover. Digital side, from my teams, not so much, but there's still,
right.
If you go to London or Leeds or some of the more urban areas, Hull isn't the most exciting place to live. So in some ways, I think it is, but that's me. We might have the sexiest accent, as Timothy Chalamet has said, but and I would probably challenge that. But I think Hull is probably not seen as the best place to live. Hull and East Riding. East Riding is a beautiful place to live, but London, York, Leeds, Manchester always get a bit more of the focus. Although I do have some people from London that do work for me remotely for nice Hull, as well as Bristol. But that's the value of that digital remote working, which COVID
There
did
you go.
force to happen, to be honest.
Yeah.
I've completely gone off pitch there, I think, David, but
No, I mean, it was great.
Yeah.
I mean, and really, it was great to learn, about the things that you've accomplished. And really it's remarkable. I mean, even like we were talking, we didn't really get into it, but just the fact that you guys are nearly completely voice over IP, I think for a health system is significant, because even here in the States, you don't see that, that often.
That's explaining to your wider board and your peers the why. So why do voice over IP? Well, analog is fairly limited with voice over IP. You could do some very fancy things. We can have a level of resilience. We can actually do managing of different calls and different options on the fly. We can integrate that with AI to some level with chatbots and answer. So all of a sudden is, when you've got the problem that people need to ring up, and the only way you can ring up is to book an appointment, is that rather than by doing IP and then tying that into an IP solution, tie that into other digital technologies, especially with AI coming in. You can then start having a converged solution around online booking using voice, but that actually, can be avatar based and that type of thing. So I think I've had some longevity in my organization that some of the stuff that I think some of my partners would say, actually, we struggle to keep our kit up to date. We have old kit. I mean, I've got 300 PCs in storage that are just about to go out of date because we just don't use them. We are all laptop based now, David. So I think that longevity and being able to show the value proposition has really made a difference in my organisation, which hopefully means that the exec team see digital as their roles, as well as rather than digital is just that guy called Lee Rickles that when we have a problem with a projector, he has to go and faff around with and play with. When realistically, all the admin know that far better than when they turn around and look at the digital person in the room. We've all been there. Projector doesn't work, laptop doesn't work. They all turn around and look at the digital person. I mean, actually, this is just stuff we do. We don't ring up the IT support for our washing machines every day. So why do we think we should be ringing up for IT and digital every day? We shouldn't be. But we're a new industry, so we will get there.
Yeah, 100%. Lee, this has been fantastic. It was so great speaking with you today. We do like to close out the episode with just a question. I like to ask all my guests, if you could go back 5, 10, even 15 years in time, what advice would you give your younger self?
Yeah. Well, probably get better hair gel, because I did actually have hair then. So no, but very all seriousness, I would go back and say, don't change your thing. Everything's going to work out fine. Just keep with the program. Just keep working hard. That would be my response, David. I think anything else would mean I'd be a different person now, and I'm quite happy with the person I am.
Wow, that is one of the more profound responses I've ever got to that question, and I kind of feel the same way. So anyway, Lee, this has been fantastic. I can't wait to catch up with you next time I'm on the other side of the pond. And thank you so much for taking the time today.
Yeah, it'll be great to see you face to face, David. And it's been a brilliant experience being on the podcast. So see you later, mate.
Cheers. And to our listeners, thank you for tuning in, and we will catch you all next week.